Good morning. Marijuana has always been viewed as a negative thing that society has looked down upon, but it's not. And I'm here today to tell you why. For dozens of years, marijuana has been thought to cause all sorts of health problems, such as cancer and lowering brain cell count, and that this damage caused memory loss, cognitive impairment, and learning difficulties. These thoughts occurred due to a claim based on an inconclusive study done way back in 1980. In which structural changes in several regions of the brain were found in 2 rhesus monkeys exposed to THC, which is the active chemical in marijuana. These changes occurred primarily in the hippocampus, the area of the brain known to play an important role in learning and memory, which suggests that exposure to THC in humans would yield similar negative results. However, according to another study, in order to achieve these damaging results, doses of up to 200 times the psychoactive dose in humans would have to be given. Even studies in which subjects were given 100 times the dose, it failed to cause any structural impairment of the brain. Additionally, in other studies, the monkeys were exposed to the equivalent of 4 or 5 joints per day through face mask inhalation for an entire year. 7 months later, there was no observed changes in hippocampal structure, cell size, cell number, or synaptic configuration. As a result of these studies, it was concluded that the claim that marijuana causes psychological damage to brain cells is incorrect, thus proving that marijuana is not such a bad substance. Since these studies and many others, 20 out of 50 of the U.S. states, including D.C., have legalized the use of medical marijuana due to the lack of evidence proving that the drug to have negative side effects on the brain and human body. But I believe all 50 states should legalize. Studies have shown that marijuana can be used for positive reasoning in the medical field. According to Ethan Russo, MD and clinical neurologist, the UK's Medicinal Cannabis Research Foundation, as well as supporters of marijuana legalization, the drug can be a safe and effective treatment for many different medical diseases, such as Alzheimer's, anorexia, AIDS, arthritis, asthma, cancer, Crohn's disease, epilepsy, glaucoma, HIV, migraines, multiple sclerosis, mental illnesses such as depression, nausea from chemotherapy, phantom limb syndrome, strokes, and Tourette syndrome, and many more. It has been proven that THC and CBD, which are both found in marijuana, are actually cancer killers and can prevent a person from ever getting cancer. It also helps eliminate nausea in cancer patients receiving chemo as well, as encourages appetites for those suffering from eating disorders, and relieves symptoms such as pain for all the diseases that I have already mentioned. On top of all these things, the suicide rates in areas with legalized marijuana had dropped dramatically due to the fact that the drug is mind-altering and can be used to treat psychological diseases such as depression. The UK's Medicinal Cannabis Research Foundation states that medical marijuana could bring a dramatic improvement to quality of life for people with these diseases. Due to all of the positive feedback on the helpful effects of marijuana in the medical field, Medscape WebMD's website for medical professionals asked its members what they thought. The results were not surprising. There was a huge response. 3 out of 4 doctors and 9 out of every 10 nurses said that they were in favor of decriminalization of marijuana for medical uses. But for the doctors still skeptical about the use of marijuana, they studied the ways to use it, such as smoking full plant and partial plants, which are burned in a pipe, joint, or bong and inhaled, which provides relief from symptoms in less than a minute, because the smoke enters the bloodstream directly from the lungs. Another way is to also bake it into foods using a THC butter. Using the butter and eating the foods eliminates the smoke that can affect a person's lungs. Eliminating the smoke eliminates the lung damage, which is what worries most people about the use of marijuana. There is very little evidence that smoking marijuana or eating it causes any damage to the body at all. There is no difference with the effects of marijuana use on the lungs than living in a city with poor air quality such as New York. So I see no reason as to why the drug should be outlawed. There is a drug that can help people with chronic illnesses, and I am all for it. Because if it were me, myself, or my family member, I would not want them to suffer because people think marijuana is a drug that is bad. Marijuana is a drug that can do more good than bad. So I believe that marijuana should be legalized for medical purposes, so doctors can do their job and help better the lives of people everywhere living with chronic and mental illnesses. Thank you.